Hello, my name is Dr. Dewan S. Raja. Today I will discuss about dengue fever. Dengue fever is caused by dengue virus. This virus belongs to Flaviviridae family. It causes acute febrile infection in human. There are four dengue viruses, DENV1 to DENV4. They are all single-stranded RNA viruses. Dengue is an endemic disease throughout the tropic and subtropic. An estimated 100 million cases per year and 2.5 billion people at risk. We have two types: dengue fever, breakbone fever, or just dengue. Dengue hemorrhagic fever or severe dengue. Vector is the Aedes aegypti and Aedes albopictus mosquitoes. They usually live inside the home, in the flower vase, or in the standing water. They may be transported from country to country through the tire of the car. Infection is caused by Aedes mosquito bites, maybe blood-borne transmission, maybe organ transplantation, bone marrow transplantation, or perinatal transmission is also possible from the to the baby, and through breast milk. It is also possible to get dengue fever. Most common by the mosquito bite are the most common cause. This is the global map of the dengue. So it is present in the Pacific islands with the US island like Guam, Western Mariana, or the American Samoa, so we have Solomon Island, Papua New Guinea, Indonesia, Malaysia, Thailand, Cambodia. Okay, so then India, Bangladesh, Pakistan, even pocket in Saudi Arabia, in the sub-Saharan Africa, okay, in the Latin America, Mexico, okay, so Latin America, and also southern part of the United States. So this is a global disease. Mosquito may be transferred from one part of the world to another part of the world, and people used to visit the tropical areas if they stay long term, and they are, or they may be, there will be more chance to get mosquito bite and more chance to get dengue infection, specifically during the rainy season. So it is a global disease. We are saying it is also present in Australia. Okay, so Myanmar, many other countries, Latin America, Mexico, Latin America, and certainly Florida, Louisiana, Alabama, part of Texas. Okay, we'll find out sign symptom image so that we can easily pick up the conception. So if we go there, this is very much simplified way. Mosquito bite by Aedes aegypti or Aedes albopictus. Okay, so there will be headache, muscle and joint pain, diarrhea is also possible, vomiting, sudden onset of high fever, stomach pain, pain behind the eyes, and rashes. Symptoms here, given more details in another source. These all are taken from Microsoft PowerPoint online. Systemic sudden onset of fever, back pain, high fever, mouth and nose bleeding, slow heart rate, hypotension, skin rash, itching. There may be petechials or stomach, vomiting, vomiting, intestinal diarrhea, joint pain, muscle-leg seizure, pleural effusion, lymph node enlargement, and central headache, altered level of consciousness. So these are the pictures of dengue fever. Okay, we go clinical picture. About 75% of infection are asymptomatic. Dengue fever is a classical fever arthalgia rare syndrome with retroviral pain, photophobia, lymphadenopathy, petechia. There's bleeding underneath the skin, spotted bleeding, and other hemorrhagic manifestation. About one-third of patients have positive tourniquet test. So if you put a cuff around the lower part of the arm and if you keep pressing, then in between systole diastole, if we press for a few minutes, then we'll get around 20 petechiae at 2.5 inches skin area. After tightening the of the lower part of the arm by a blood pressure cuff or tourniquet, we'll get this. And if it is kept for a few minutes, then we'll get the petechia formation. Okay, that is present only one-third of patients in dengue fever. Dengue hemorrhagic fever begins as non-specific febrile illness with the usual petechial rash. Fever subsides the third and seventh day of illness, followed by vascular permeability causing plasma leakage from the blood vessels to the tissues, elevated hematocrit. Hematocrit, we know that the proportion of the formed element of the blood to that of the plasma is because the fluid is missing out of the blood vessel. So the blood vessel will contain blood cell with less amount of fluid. So there will be high hematocrit. Edema and effusion, thrombocytopenia, positive tourniquet test, and spontaneous bleeding here in dengue hemorrhagic fever or severe dengue. Okay, how to diagnose dengue fever? Complete blood count will get leukopenia, thrombocytopenia, isolation of dengue virus from plasma by PCR, polymerase chain reaction. After fever subside, IgG, IgM antibody detected by ELISA, enzyme link immunosorbent assay, and we can do enzyme immunoassay anytime. We can do chest X-ray to reveal the pleural effusion if it is present. Pleural effusion is the collection of fluid between the parietal pleura and the visceral pleura. Treatment: there is no specific antiviral drug exists for the dengue. Patient should be well hydrated, so they will drink a lot of fluid, water or fruit juice. Avoid aspirin or NSAID, paracetamol or acetaminophen or Tylenol, and tepid sponging. Avoid mosquito bite to block further transmission of the disease. Hospitalization for severe dengue patient may be in the intensive care unit. Prevention: must remember no vaccine available in the USA, but many other countries has effective vaccine program. No prophylaxis available. Travel may be avoided or shortened in the endemic area, particularly during the rainy season. If the person has some signs symptoms of dengue fever, he must go to the public health department or to the CDC to get the guideline. Okay, so avoid mosquito bite, long sleeve dress, use of mosquito repellent, maybe mosquito net, and people should live in airtight houses with good air condition. Okay, destroy the mosquito and breeding site. That is very important. Okay, so we got the dengue fever. And that's all for today. Please share the information with your friends. If you have any question, please feel free to ask me. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.